Ready?
Yep.
All right.
And then you remember we're doing.
Yeah, I always keep.
Good morning and welcome to Street Beat. I'm your host, Rob Stone. And let's face it, guys, many of us don't always make the best choices when it comes to our health. We skip those annual checkups and screenings, we ignore important warning signs, and a lot of times we just don't pay attention to our diet or get enough exercise. And the month of November is dedicated to raising awareness for men's health, and today we're going to do just that. We'll be talking to doctors and health experts to help you get back on track to a healthy lifestyle. Our first guest is Dr. Sohail Saba. He's a cardiac doctor with Providence Hospital in Southfield, and thank you so much for being here.
Thank you for having me, Rob. It's
Absolutely. So let's just first talk about the most common types of heart disease.
Well, unfortunately, men are more prone to develop heart disease than women, and we are seeing this manifesting at an earlier age in our life, and this is related mainly to our lifestyle. So probably the leading cause of heart disease in men is developing blockages in the arteries that bring blood flow to the heart.
And you said you're starting to see this develop earlier in men's lives than in the past.
That's very true.
Why do you think that is?
And unfortunately, because of the modern lifestyle that we carry, diet, lack of exercise on a regular basis, decrease in activity level, and our dietary habits have played a big role in this.
Okay. So do you think that's just kind of part of, you know, maybe being too busy to go to the gym or being on the run, eating fast food and things like that?
Very true. So I always tell my patient, we used to exercise for work when we were to go out, be active. Now you have to pay money to go to exercise. You have to find time for it. Our ability to move has decreased significantly, and this has translated in significant increase in weight, and unfortunately that brings with it heart disease.
Right, so I guess, you know, a lot of jobs sitting behind the desk, behind the computer, you don't realize that you're not getting that exercise you would in, you know, some of your manual labor jobs.
Very true.
Now, is heart disease genetic as well? Does that play a factor?
Absolutely, and this is the one factor that we cannot change in heart disease is who we are. So there are 5 traditional risk factors for heart disease. Everything can be modified except your genetic makeup.
Okay. Now, besides genetics and some of those other issues we talked about, are there any other factors that would contribute that we might need to keep an eye out for?
Absolutely. So the traditional risk factors, and this is now very commonly known, is high blood pressure, high cholesterol, diabetes, and being overweight, and smoking. And as you could see, they're all modifiable.
And as we were talking about before, you know, with men, guys are kind of known for ignoring some of the warning signs and, you know, being a little bit stubborn about going to the doctor. What are some major warning signs that we definitely should not ignore?
Very excellent question. So the typical symptoms are of any discomfort or pressure sensation in the chest, but we have learned that on many occasions the presentation may not be classic. So any symptoms in the chest or frequently what's maybe thought as a heartburn or indigestion or shortness of breath or tightness in the chest, this should definitely alert us. Sensation of a rapid heartbeat, breaking out in sweat, these symptoms definitely should alert us that an investigation of an underlying cardiac problem is probably needed.
And now, if we are having some of those symptoms, besides calling 911, what is the first thing that you should do if you are the one feeling the symptoms, or if you see someone maybe having those?
So if we're talking about the presentation that may be a heart attack, sensation of pressure or tightness in the chest, 911 is a very important call. I'm glad you mentioned that. It's much preferable to own transport or transport by a family member because things can take place. Reach to an aspirin. That can help also. If you have somebody that has nitroglycerin around and if we suspect there may be a heart attack, that can help. But 911 is the most important first step to call.
Now, hopefully, we'll not get to that point. So what are some of the biggest precautions as far as diet and exercise? Are there certain foods that we should be eating, certain foods we should be getting rid of?
Absolutely. So we have to realize that these diseases take a long time in preparation before they manifest clinically. So we have many years to work on our lifestyle. We have to work on food, both quality and quantity. So if you notice, we have drifted from natural food into many processed and man-made food. So I strongly recommend incorporating fruit and vegetables. The simple rule is you'd like to have 5 colors a day in your diet. It's very important to focus on the quantity. Because of the decrease in activity, we don't need as many calories as before. So the quantity, and we should avoid eating late and heavy meal when we come home and we're tired and we're hungry and we have nothing to do but eat and watch some TV.
Right. Okay. So diet, obviously a big thing. Anything else you'd like to add before we get going?
Exercise, and we really have to incorporate this. We are all busy, but we have to find ways. For example, my office is on the 7th floor. I never use the elevators. And I tell our patients, we could find simple steps. Park your car a little bit further when you go shopping rather than circle around for the closest parking spot.
There you go.
Walk. We have now a lot of new gadgets that can track how many steps we make a day, and we aim for 10,000 steps a day.
Perfect. Well, thank you so much for all the information, and we obviously have a lot more to go over, so for more info, you can check out Cardiac Health. Go to stjohnprovidence.org. And coming up next, we'll find out about the most common cancer found in men when Street Beat returns. Stay with us.